Perimenopause is a dumpster fire. I like to call it the mean girl of our hormonal eras. You got puberty, you got pregnancy, you got perimenopause, and then you got postmenopause. And perimenopause is a mean girl because you're getting bombarded from both sides. You can still be having, You're still having sporadic menstrual cycles. They can be heavy, they can be close together. You don't know when the hell they're gonna come. You think you're in the clear, it's been several months, and then boom, you're on vacation and there she is. Other issues that you can be experiencing are hormonal declines. So estrogen levels are declining. So you can be having the hot flashes, the night sweats, the vaginal dryness, vulvar dryness, decreased libido because your testosterone levels are declining some too with your decline in ovarian function. So you're just getting pummeled from both sides. And on top of that, there's still a chance of pregnancy for some women. The tough thing is trying to manage both sides of those symptoms, and we don't have a lot of data on good treatments for perimenopause, so a lot of times we end up putting someone back on a continuous birth control pill. That can be helpful if their cycles are really crummy and can also help sort of even out those hormonal ups and downs, and of course provides contraception. Some women like to get a hormonal IUD to manage their menstrual cycles, and then they'll take other things hormonally. There are some supplements that might help with some of those ups and downs. There's antidepressants, anti-anxiety medicines, depending on your predominant symptom. And then there is menopausal dose hormone therapy, which does help quite a few women. Sometimes I find it actually exacerbates some of their symptoms, or sometimes they might blame some of their side effects on the hormones when it could very well have just been their spontaneous menstrual cycle because they got breast tenderness, they got moodiness. And, with those hormonal fluctuations, we can definitely see more of those symptoms in perimenopause unrelated to whatever therapy we're using. But the other thing I want to mention is that perimenopause is generally occurring in our late 30s or 40s. As we get closer to the menopause transition, as we get closer to our last menstrual cycle, I think the symptoms they get worse. Your weight gain and other things like that get a lot worse. And it's important to make sure you're not missing any other medical explanation for your symptoms. Um, I'm going to be sharing my story in some upcoming videos because I thought what I was experiencing was just perimenopausal crappiness. And I was doing all the things, exercising and trying to eat right and trying to drink less and trying to get sleep. And I was taking hormones and I still felt awful. So sometimes we need to dig a little bit deeper. And I don't want to create mass hysteria because perimenopause usually is just perimenopause, hormonal fluctuations. We can't really measure them, but it's also important to rule out things like thyroid disease. If you're having palpitations, certainly can be hormonal, it can be perimenopause, but also looking a little bit further too, because as women, a lot of our cardiac conditions, our strokes, our chronic medical problems, they take longer to diagnose in us than they do in men. In fact, I just read an article about it. I think it was a obstetrics and gynecology journal or something else talking about that it takes women on average an extra year to get diagnosed with their chronic medical illness than a male.